Hi, welcome to our channel of IGNOU Audiobooks, Indira Gandhi National Open University School of Health Sciences, SOHS. Post-Basic Bachelor of Science in Nursing B.Sc.N. PB, Revised. First Year. BNS 201 Nursing Foundation. Block-1 Concepts in Nursing. Unit-4 Interpersonal Relationship in Nursing. 4.0 Objectives. After going through this unit, you will be able to define interpersonal relationships, explain the process and principles of interpersonal relationships, discuss the phases of development of interpersonal relationship and the tasks associated with each phase, explain the role of nurse in establishing therapeutic relationships, list the factors enhancing interpersonal relationship, and identify the factors which lead to poor interpersonal relationships. 4.1 Introduction. A relationship is an interpersonal process where two or more people interact with each other. We meet people in a variety of settings and share our experiences and develop a kind of relatedness. The basis for good interpersonal relationships is respect for human personality with an understanding of the problem of other person. Understanding leads to cooperation and trust, which brings in harmony and happiness, which is very significant in developing therapeutics relationship low in other patient. 4.2 Definition. A healthy interpersonal relationships is one in which the individuals involved experiences intimacy with each other while maintaining separate identities. According to Sullivan, intimacy is characterized by sensitivity to needs of the other person and mutual validation of personal worth. Interpersonal relationship is a series of interactions where one individual perceives the other individual as a human being. Interpersonal relationships in nursing is a mutually significant experience where both nurse and patient view each other as a unique human beings. Nurse-patient relationship is an interaction process in which the nurse fulfills her role by using her professional knowledge and skill in such a way that he is able to help the patient physically, socially, and emotionally. Kapoor 1994. Characteristics of healthy relations: open communication of feelings, acceptances of other as a valued unique identity, deep empathetic understanding. 4.3 Process, Principles and Characteristics of Interpersonal Relationship. Let us begin with Process of Interpersonal Relationship, IPR. 4.3.1 Process. Peplow, 1951, defined nursing as an interpersonal process. She also mentioned the importance of basic human needs. She considered two interacting components of health as physiological demands and interpersonal conditions. The crux of the therapeutic process is the corrective interpersonal experience. If two individuals have healthy relationship with each other, both can learn to have more satisfying interpersonal relationships. Closeness in interpersonal relationship builds trust, facilitates empathy, enhances self-esteem and fosters growth towards healthy behavior. Peplow termed this process as psychological mothering, which includes following steps: unconditional acceptance as a participant in a relationship that satisfies needs. There is recognition of and response to one's readiness for growth. Power in the relationship shifts to the one in need, helpee, and he in turn is able to delay gratification and to invert energy in goal achievement. 4.3.2 Principles. Given below are the principles which one needs to apply in establishing and maintaining interpersonal relationships. Principles of recognition. Principles of mutual understanding. Principles of inculcation of common interests. Principle of respect for human dignity. Principle of personality development. Principle of stimulation, motivation and encouragement. Principle of incentives, rewards for good accomplishment. Principle of honesty, punctuality and trustworthiness. Nursing is considered as an interpersonal process, which is often therapeutic, in that people benefit from the interaction. Nursing is also a human relationship between the one who is in need of health services and the nurse who is trained and prepared to respond to the need in therapeutic manner. The characteristics of a therapeutic relationship may include the following. 4.3.3 Characteristics of therapeutic relationship. Genuineness. The individual involved in relationship is an open, honest and sincere to himself and to the others. It is opposite to self-alienation where individuals' real and spontaneous reactions to life are suppressed. Genuineness means the person says the same thing what as he feels and not saying something different than what is feeling. Respect, caring, liking, and valuing are other terms for respect. It is non-possessive. Warmth or unconditional positive regard which does not depend upon other persons' behavior. The other person is regarded as a person of worth and is respected, but this does not mean that we condone or accept all aspects of the individual's behavior as desirable or likable. The behavior is viewed as normal, natural, and expected in a growth circumstances. Empathetic understanding. Empathy is an ability to enter into the life of another person and to perceive his or her current feeling accurately. Rogers, 1975, described it as to sense the client's private world as if it were your own, but without losing the as if quality. A high degree of empathy is one of the potent factors in bringing about change and learning, one of the most delicate and powerful way we have of using ourselves. One has to keep aside one's view and values to enter another's world without prejudice. Accurate empathy is important for creating an environment in which a person can grow towards wellness. Active listening and creative listening are other terms used for empathetic understanding. Empathy is of two types. 1. Basic empathy. 2. Trained empathy. Basic empathy is a natural ability of an individual to feel for others, and trained empathy is taught and learned for helping others. The trained empathy can also be termed a professional or clinical empathy. Genuine and unconditional regard and empathetic understanding conveyed to the other individual gives him or her personhood or identity. This leads to changing self-concept resulting in changed behavior. Concreteness. Use of specific terminology rather than using of abstraction in the discussion of patients' feeling, experiences and behavior. It is opposite to generalizing. Categorizing, classifying and labeling thus avoids vagueness and ambiguity. Concreteness keeps one person's responses close to the feelings of the other person, fosters accuracy of understanding and can contribute to empathetic understanding. The level of concreteness vary during different phases of interpersonal relationships. Nurse-patient relationship. In orientation phase, concreteness should be high as this will contribute to empathetic understanding, while a low-level concreteness may be required to facilitate through self-exploration. High level of concreteness is essential at the termination phase, when patients are engaging in action. Genuineness, rapport, empathetic understanding, and concreteness facilitate the formation of therapeutic nurse-patient relationship. Interpersonal relationship. 4.4 Difference between therapeutics and social relationships. The difference between therapeutic and social relationship described by Kapoor, B. 1994, is given below in Table 4.1. Table 4.1 Difference between therapeutic and social relationship. Look at the screen. 4.5 Phases of nurse-patient relationship. There are 4 phases of nurse-patient relationship. Kapoor, B. 1994. I. Pre-interaction phase. 2. Introductory or orientation phase. 3. Working phase. 4. Termination phase. The pre-interaction phase begins when the nurse is assigned a patient to develop therapeutic relationship with him/her till she goes to the patient for interaction. The tasks are that nurse explores her/his own fears and anxiety, sets objectives for interaction phase, takes help of the clinical supervisor or coworkers to overcome the fears. Introductory orientation phase. It begins when the nurse goes to the patient and introduces herself/himself to the patient. The tasks are that the nurse introduces herself/himself to the patient, talks with the patients. Working phase. Working phase of the nurse-patient relationship starts when the nurse and patient start interacting with each other and nurse collect the data from primary and secondary sources, assists the patient to identify his/her problem, plan the nursing intervention. Termination phase is also called as resolution phase. It begins with orientation phase itself when nurse explains to the patient the purpose of care to the patient. The tasks of nurse would be to help the client to make best use of the services available, get prepared for discharge, get informed about rehabilitation and follow up. 4.5.1 Phases of nurse-patient relationship. All the therapeutic relationship go through some phases. These phases may not be clearly demarcated, but they do happen. The details of these phases you will be studying in Unit 6 of this block. I. Orientation phase. This is the phase when patient and the nurse get to know each other. They start off as strangers, though the nurse has the advantage of having some information about the patient through his records and from other nurses before she meets him. The nurse takes the initiative in the relationship by introducing herself to the patient and setting goals for working phase. In this phase, relationship is established through continued development of trust. Patient is being assisted to verbalize thoughts and feelings while the strengths and weaknesses are being assessed. Sometimes certain barriers appear, such as the spoken language, manner in which nurse and patient perceive each other, or anxiety of both the participants in the interaction. 2. Working phase. The working phase begins when nurse has collected all the information and begins to draw up a plan of care for the patient. In this, the nurse and the patient develop mutually agreeable goals, and contract is formed. For example, I shall demonstrate deep breathing exercises that you need to do before surgery. You need to practice them 4 times a day on your own so that you can perform them post-operatively on your own. During this phase, nurse can take several therapeutic maneuvers. For example, offering support, remaining with the patient during stressful situation, helping the patient to arrive at his own decision, and helping the patient to see his strengths, progress and successes. If the goals are met, contract is terminated. If not, a new contract is negotiated. Sometimes certain barrier can arise to accomplish the task, such as when patient starts testing the nurse or nurse's unwillingness to engage in the tedious task of improving her ability to collect and interpret data. 3. Termination phase. Termination is one of the most difficult but most critically important phases of nurse-patient relationship. There are several reasons for termination of relationship, such as when patient gets discharged or nurse's duty is transferred, or when patient can manage his own health needs and care within reasonably safe limits, or patient may be transferred to another ward or institution. Relationship can be for short duration or long duration. Depends on the situation, but feeling of loss is inevitable. This feeling one can overcome if the goals have been met and the patient no longer needs the nurse's care. We can review with the patient the accomplishments that have been made. Sometimes it is necessary that another person of your patient do this. In this case, introduce the patient to the person who will be carrying for him. In case of transfer, prepare the patient for transfer. In larger hospitals, a nurse is employed as discharge co-coordinator and can assist in facilitating the discharge. All the phases have action-oriented conditions which facilitate growth. Based on the interpersonal theory of Peplow, there are 4 phases of nurse-patient relationships. These are orientation, identification, exploitation, and termination. One can visualize an overlapping in all the phases. Orientation phase. Nurse identifies patient's problems. Mutually formulate a contract. Identification phase. Exchange social amenities. Nurse identifies patient's problems. Clarify each other's roles. Nurse clarifies or corrects the misconceptions on previous experience. Exploitation phase. Nurse and client start experiencing each other as unique individuals. Client experiences acceptance. Client develops high degree of trust in nurse. Client starts taking full advantage of the nurse-patient relationships. Client develops ability to test. Termination phase. Mutually explore feelings of rejection, loss, sadness, and anger-related behaviors. Client learns that termination is important. Client learns that termination completes therapeutic relationships. 4.6 Role of a nurse in development of interpersonal relationship. Throughout the 4 phases of nurse-patient relationship, the nurse performs several roles. These are presented in following box. No. 4.1 Peplow's theory is mainly concerned with the need for growth and development and with psychosocial needs. Peplow states that the nursing process is educative and therapeutic when nurse and patient comes to know each other as persons who are alike and yet different as persons who provided care and help in the solutions of problems. She states that nursing is an interpersonal process that is often therapeutic and a force that promotes development of personality in becoming more creative and productive. Box 4. 1. Role and definition. Stranger, the roles assumed by both the nurse and client. In the first meeting, resource person provides knowledge and answers specific questions about the health promotion. Surrogate acts as substitute figure that the client imagines the nurse to be. Teacher identifies learning needs of the client and uses a combination of roles to develop client's interest in medical information. Leader provides direction during present problems. Socializing agent participates in social activities with her patient. Manager establishes and maintains therapeutic environment to improve conditions for patients' recovery. Counselor facilitates self-directed actions to help patients to learn to adopt to changed lifestyle. 4.7 Factors enhancing interpersonal relationships. Interpersonal factors refers to those factors involving relationships with others. The helpfulness of the support offered by others and satisfaction gained from it are critical to enhance good interpersonal relationships, cooperation, and mutual understanding between nurse and patient, nurse and nurse, nurse and doctor, and nurse and patients. Relative are imperative to good interpersonal relationships. Cooperation and mutual understanding between all members of health team including patients are the basis of efficiency and is greatly influenced by the nurse in charge of the unit. If interpersonal relations are good, patients are well cared for and personal problems are reduced. Concreteness in communication, immediacy in communication, anti-sensitive confrontation is an important factor in establishing and maintaining good interpersonal relationships. The individual is helped when he is encouraged to express his concerns and willingness to clarify explicitly. The most effective helper, nurse, does not avoid discussion about the dynamics, interaction, occurring within their relationship. Nurse needs to develop some of the following characteristics which can help her establish good interpersonal relationships. Listen patiently. Talk meaningfully. Avoid hasty judgment. Judge unemotionally. Interpret properly. Avoid gossip. Avoid criticize. Acquire adequate knowledge regarding the policy and administrative setup. Know the other health agencies. Acquire communication skills. Respect others. Accept constructive criticism. Behave as human being towards patient, genuineness. Sensitive to point out discrepancies in patient's behavior. 4.8 Factors leading to poor interpersonal relationships. The following factors can lead to poor IPR. Lack of interest in work in some personnel may burden the other person, which may spoil the friendly environment of the department. Lack of self-understanding and understanding of others is another factor leading to poor interpersonal relationship. Lack of understanding how you respond to others and what you expect from them. Deliberately ignoring someone without any cause is another factor leading to poor interpersonal relationships. Embarrassment for oneself and others from non-acceptance also contributes to poor interpersonal relationship. Unwilling to accept help and advice from others may also lead to unhealthy interpersonal relationships. There may be personality clash among people working in a unit. The clashes are usually caused by difference in styles of working. Conflicting ideas might arise from different backgrounds and lead to poor interpersonal relationships. 4.9 Role of a nurse in improving interpersonal relationships. In interpersonal relationship, the nurse may use various methods to achieve good interpersonal relationships, and these are definitely very important. Some of the methods are detailed below. Willingness to give and take. You had an unhappy experience with a friend of yours in school time and started disliking her. In the hospital, you meet a fellow nurse who resembles your old friend, so you decide that you don't like her type. And it seems you won't like her either. You work with her, but she doesn't enjoy working with you. So she decides that she dislikes you. Your relationships are bound to be strained, as this made working environment tense and unhappy. All that needed here was willingness to accept your colleague as an individual, not as a type. One nurse commented publicly that she doesn't like community health nurses, CHN, and she wouldn't work with the community people. Unfortunately, she had to work in the community health field where nurses had very good IPR, which led her to change her attitude towards CHNs. She was also able to establish good IPR. While working in the hospital, you have many opportunities to please others by being willing to let them do you a favor which is perfectly acceptable from a professional point of view. Sometimes we can do a better job, but we let others do it to please them. A patient starts telling you some news from the newspaper, which you already know. If you want him to feel happy, you will let him tell you the news. Healthy, enjoyable and good interpersonal relationships are possible among those individuals who understand the importance of unselfish acceptance and they believe in the principle of willingness to give and take. Be cooperative and appreciative with all your colleagues. 2. Acceptance of others. Nurses come in contact with a variety of people, some attractive, some are unattractive, aged, young, rich or poor. Keeping in mind the ethics and professional commitment, nurse accept the fact that he need to give excellent care regardless of his own feelings. Nurse needs to overcome the feeling of distaste for anyone whose standard of personal appearance is different from his own. To have satisfactory relationships with others in every situation, we must accept that others have right to their habits as we have to ours. Exerting undue influence on anyone to change may not bring a long-lasting improvement, rather it may end up in a dislike for you and nothing else. While caring for a patient, it is important to accept him as he is. The nursing activities a nurse undertakes will become more Rewarding and successful if the nurse has developed rapport with the patient and accepting him as he is first step towards it. Through personal acquaintance, one can get to know people better than just hearing about them or seeing them, thus improves interpersonal relationships. Respectful and healthy interpersonal relationships in the medical and nursing care of patients demand understanding and appreciation of special responsibilities each member of the health team has. Acceptance and cooperation leads to healthy and conducive atmosphere for congenial and productive working relationships. 3. Self-acceptance. If we know or understand why we behave as we do in certain situations, it will help us to understand the behavior of others and adjust accordingly. Sometimes we feel glad to meet someone, whereas other time we will be inclined to wait for other person to take initiative. This happens with everyone and it is normal. We must know what we do and why we do it, depends upon our familiarity to the environment, our status with our partner at that moment, duration and type of acquaintance with him/her. A professional nurse requires development in the socio-cultural aspects of life as well as in scientific and technological aspects. This is possible if the nurse sets some realistic and achievable goals for progress in all phases of nursing education. 4. Know-how. It is very easy to preach but difficult to practice, well said by a wise man. I want to adjust with others. I want to get along well with others. I want to give love to others and be loved by others. I want to accept everyone at any time in every situation. These are commonly expressed concerns of people, but how to go about it? No definite steps to be followed which can be listed, however. Some suggestions can be of some use to the nurse as given below. Courteous and respectful gesture to everyone will be fruitful. Willingness to accept help and advice from others. Communicate skillfully, avoid being argumentative and thrusting your opinions on others. Keep the tone of voice and laughter under control. Get acquainted with all types of people. Take advantage of time factor. Try to overcome your annoying and nervous habits, such as sniffing, finger tapping, whistling, continuous humming, etc. Be careful of other people's possessions. Share appreciations with colleagues and other members of health team. Take your share of the blame in any situation. Should be generous and sincere in compliments. Try to clear up misunderstandings at the earliest. Be a modest loser and good winner. Avoid embarrassment for oneself and others. Indulging in spiteful gossip need to be evaded. Deliberately ignoring someone without good cause should be avoided. Emotional maturity. A mentally healthy person is enriched with emotions as he attains maturity and uses them intelligently. A nurse is considered to be mature person endowed with emotions. She can assess her present status in this respect and guide her progress ahead. Given below are some statements which can help you score your maturity level. An emotionally mature person is able to control his emotions in most situations. Use repression, a defense mechanism, what to forget and what to remember. Refuse to let easily hurt people, make him feel guilty and remorseful over trifles. Feel secure in the relationships with others. Expect to be liked, valued and accepts the facts which doesn't let it lead to lower the self-esteem. Carry on his work in spite of upsetting personal circumstances. Recognize his own need as well as others' needs. Adjust to wide range of personalities without being emotionally involved. Keep his religious life in proper perspective. Refrain from being judgmental on emotional basis. 6. The nurse and her patients. The first responsibility of the nurse is to establish rapport with her patient as she plans comprehensive care for him. The patient also carries some responsibility unless he is mentally sick or acutely ill physically. A sense of humor, infinite patience and dignity will help the nurse to earn respect and liking from her patient and keep her relationship as a professional one. Therapeutic relationships with patients who are fearful, shy, unsure of themselves can help them express their needs. Warm professional atmosphere conducive for patients, recovery can be achieved through good interpersonal relationships at the unit. 4.10 Summary. In this section you have learnt about establishing and maintaining interpersonal relationships, its phases and roles the nurse enacts in these phases. The factors enhancing the good interpersonal relationships and factors leading to poor interpersonal relationships are also discussed. All the information given in this section can be applied in your work setting. Thank you.